Healthy Living with Van warmly greets my dear uncles, aunts, and cherished older friends. I'm a doctor, now over 50 years old, with more than 30 years of walking alongside patients, from those whose strong legs could carry them everywhere, to those whose legs have weakened and now rely on a cane or wheelchair. You know, our feet are silent companions that have carried us for decades, yet they're often forgotten. We care for our hair, our skin, our heart and liver, but how often do we ask ourselves, are my feet healthy? Are they still strong enough to take me wherever I wish to go? Today, I want to share 7 small morning habits, tiny things, but if you do them daily, your feet will stay strong, flexible, free from aches, and keep you steady even into old age. And I'll also share 5 warning signs in your feet that could signal diabetes, heart disease, or nerve problems. Over the years, I've realized something. Sometimes, your feet are a mirror, reflecting the health of your whole body. Some patients come to me for what they think is just a mild foot pain or a toenail changing color, but upon examination, I discover diabetes, vein problems, or even peripheral neuropathy. That's why today, I want to share 5 foot symptoms you should never ignore, because sometimes, catching them early can prevent serious complications. Part 1. 7 morning habits for strong, healthy feet. 1. Sit on the bed and massage your feet for 2 minutes before touching the ground. Many people jump straight out of bed in the morning. But after decades of service, our feet deserve a gentle wake-up. How to do it? Sit on the bed, place one foot on the opposite thigh, and use both hands to massage the sole in circles, from heel to toes. Press gently on the hollow in the center of the sole, the yang quan acupoint, to stimulate circulation. Benefits: improves blood flow after a long night's rest. Reduces dizziness and the risk of falls when standing up suddenly. Story: Uncle 2, 68, used to feel numbness in his feet upon waking. Since adopting this habit, he says, "My feet feel completely awake, light like when I was young." 2. Stretch your calves and Achilles tendons. Before walking, wake up the tendons and muscles, especially the Achilles tendon behind your heel. How to do it? Stand facing a wall, hands pressing on it. Step your left foot back, heel on the floor, right knee slightly bent. Hold for 20 seconds, then switch legs. Benefits: prevents cramps and calf tightness. Improves knee and ankle flexibility. 3. Drink a glass of warm water to boost circulation from within. After a night's sleep, your body is dehydrated, and your blood becomes thicker, making blockages more likely, especially in your feet. Drink about 200 milliliters of warm water before breakfast. Add a slice of lemon or a pinch of sea salt if you like. Benefits: improves blood circulation, reduces swelling, and lowers varicose vein risk. 4. Walk gently in place or around the house for 5 to 10 minutes. You don't need to go far, just walk in place or around the yard or hallway. Wear soft-soled shoes to reduce heel impact. Step lightly, without putting too much pressure on the knees. 5. Eat a nutrient-rich breakfast for bones and muscles. Strong feet require not just exercise, but also the right building materials. Suggestions: oatmeal with milk and walnuts, whole grain bread with boiled eggs, or pan-seared salmon with greens. Key nutrients: calcium milk, small fish, leafy greens, vitamin D morning sun, fatty fish, protein lean meat, beans. 6. Check your feet every morning. Especially if you're over 50, diabetic, or have poor circulation. Look for cuts, color changes, or swelling. Reason: foot injuries heal slowly and can become infected if unnoticed. 7. Take deep breaths and relax before starting the day. Stress can reduce blood flow to your legs, making them feel heavy. Sit up straight, close your eyes, inhale deeply through your nose letting your belly rise, then exhale slowly through your mouth. Repeat 5 to 10 times while imagining your feet healthy and ready to take you everywhere. Part 2. 5 foot signs that could indicate diabetes, heart disease, or nerve problems. 8. Numbness or loss of sensation. Feels like tingling, pins and needles, or total loss of touch, often starting at the toes and moving up. Possible causes: peripheral neuropathy from long-term diabetes, poor circulation from heart disease. Danger: you might not notice cuts or burns, increasing infection risk. Story: Uncle Sal, 65, with diabetes, stepped on a small piece of glass without feeling it. Days later, the wound was badly infected and required surgery. Advice: If numbness lasts more than 2 weeks, see a neurologist or endocrinologist. 9. Persistent cold feet. Feet feel icy even in warm weather. Possible causes: peripheral artery disease, heart weakness, or autonomic nerve damage from diabetes. Story: Ms. Han, 58, thought it was just cold feet from the weather. A test revealed her arteries were 70% narrowed. She received timely treatment and lifestyle changes. 10. Unusual skin color changes. Feet or toes turn dark red, purple, or pale, sometimes with mild swelling. Possible causes: chronic venous insufficiency, poor arterial blood flow, or diabetes-related skin changes. Story: Mr. Nam, 72, came in because his little toe turned purple. It turned out to be a small artery blockage. 11. Sores or cracked heels that heal slowly. Tiny cracks or ulcers on heels or between toes linger for weeks. Possible causes: diabetes, poor circulation, or fungal infections. Story: Mr. Loy, 60, ignored a small heel crack and treated it with folk remedies. 2 months later, the wound had grown to 3 centimeters and required surgery. 12. Thickened, discolored, or misshapen toenails. Nails become thick, yellow or brown, curved, brittle. Possible causes: fungal infections, poor circulation, or nerve damage. Story: a 63-year-old patient ignored her nail changes until she developed severe nail bed infection requiring antibiotics. My dear friends, our feet are like old companions. If we give them a few minutes of care each morning, they will repay us with strength and reliability all day, all year, all our lives. Start tomorrow morning, and see how your feet change after just 1 month. Because healthy feet are the foundation for independence, to visit children and grandchildren, go to the market, stroll in the park, simple joys that are priceless. If you found this video helpful, please subscribe to Healthy Living with Van Van so you won't miss simple, effective health tips. I wish you always walk firmly, so every day of life is a complete journey.